Hello students, we will discuss a common condition which we come across regularly in surgical OP or in surgical practice as such. What this condition is, see that ankle, there is a swelling here, quite big it is, and little shiny also, smooth surface. Of course, on examination will be able to feel restricted mobility, maybe skin is free or not, surface, hardness, consistency, firm or whatever it is, relation to the joint movement, opposite side you have to examine, distal pulse, lymph nodes, other systems, everything, compare opposite side also important. All those clinical exams have to be done. When any swellings, examination of swelling in detail should be done as per clinical methods, of course. And see that when you take X-ray here, you can see the calcification here. See that typical, this is the calcification here. So it is definitely a calcified adventitious bursa. All of you know that bursa can be anatomical or adventitious. Anatomical where friction occurs and naturally it is there. So that prevents the friction in wherever friction is possible, naturally it is there. Adventitious in a different way, it is an acquired one. Anatomical types are subaoist, subacromial, olecranon, prepatellar and infrapatellar, suprapatellar, psoas bursa. All these things are anatomically, naturally it is there. It is needed. But when it inflamed, it forms a swelling. Prepatellar bursitis, infrapatellar bursitis, suprapatellar bursitis, psoas bursitis. Otherwise, naturally it is bursa is there with some fluid to avoid friction. Whereas adventitious is an acquired one, bunion near the great toe, around the head of the metatarsal, around the ankle talus bursitis or bursa, retroachilles and so on. So this is an adventitious bursa in the around the ankle, which is calcified. Eventually it may get calcified, it may get infected, it may form an ulceration, all those things. So that is the adventitious bursa. It's a typical adventitious bursa. So students, bursa in detail you can read my clinical methods, how to examine a swelling and bursa. And in detail about different types of bursa, it's enough diagrams, illustrations. You can go through my book and upload surgery, how to excise a swelling. And all upload surgery you can detail my upload surgery book, including digital now lectures, covers everything for UGs and postgraduates. So hope you will purchase and go through these things so that you will have the clear idea about the subject. So students, I hope you have understood adventitious bursa, which is calcified, very well. Thank you very much.